Alhamdulillahi Rabbil Alameen, wassalatu wassalamu ala Rasulihil Kareem wa alihi tayyibin at-tahirin al-mahsunin al-maslumin. Thank you very much for inviting me over for this session. I would like to thank the organizers for giving me the opportunity to come and speak to you about a subject which is very close to my heart, and I'm very compassionate about it. I've done an MSc in allergy over 3 or 4 years. And when I was asked to speak to you all about allergy, I think I was thinking about how would I summarize my knowledge of over 5 years into 15 and 20-minute session. As the brother said, it's such a common problem we are all facing as parents nowadays. So I haven't prepared any slides, haven't put a lot of scientific knowledge into it. But the whole concept of this talk is just to have an informal discussion and to help people who have children or adults who are currently suffering from allergies, give them some hands-on tips and help them manage, or people who have children who don't have the diagnosis yet, just to give them some information as to what's the best way of getting the diagnosis and the specialist services we have available in NHS. A lot of people ask me why did I choose field of allergy. And the very simple answer is that my own 2 children, I have 2 boys, mashallah, they both had allergies when they were children, and alhamdulillah, they've grown out of it. But I think as a mother and as a doctor, it was a difficult journey, having children who have got severe allergies, and not only just the skin allergy, but they have food allergy. So yes, shopping used to take a lot of time, reading all the labels and everything. So I can give you not only my medical knowledge, but also my hands-on experience as a mother of managing 2 children who had multiple food allergies. I graduated from a little bit about my background, just to give you a bit of more information about myself, to be honest. So I graduated in 2004 from Army Medical College, and came here, got married and came here, and I did all my training here. So my training was predominantly in acute medicine, did a bit of pediatric work, and currently working in geriatrics. So in 2007, when my older son was born, he started off with very severe eczema, and ended up having an anaphylactic reaction to milk when he was 4 months old. And that was the time when actually I thought and asked myself the question of what allergy is actually. Because undergraduate medical school, I had very limited knowledge, to be honest, of any allergy. And in our country, back home, the incidence of allergies was very low at the time. And I'm sure it's on the rise, and I'll get back to that point when I come to the discussion about what allergy is and how it develops. So I did my MSc as a part-time over 4 years at Imperial College London, and prior to doing my allergy MSc, I did some courses just to get a bit more basic physiological, and to understand the more physiological processes which involve allergy. And I did some clinic at Chelsea and Westminster in allergy. And I'm very passionate about it, not only because my own children have allergies, but I've also seen in pediatric population, not only children, but how the mother and parents are suffering because of their allergies. So I'll just highlight the most important facts which probably are relevant to day-to-day life. First of all, what is allergy? The commonest type of allergies, and the reason why we're seeing such a big rise in allergy, and there's research around it, which has been going on for years. And then some management, very common and easy way of explaining how we commonly manage allergies. And then I'm more than happy to take questions. I'm not going to use any specific statistics, as I said, because I haven't prepared my formal talk or lecture. But if somebody is interested and they want to find out any scientific basics or any statistic, then more than happy to contact me directly. Allergy is a form of immune mechanism which your body, so all of our body has got an immune system which recognizes all the foreign particles. Allergy is an immune-mediated reaction to harmless agents, which means that if you have an infection, a virus or a bacteria, which comes and attacks our body, our immune system can recognize it and knows and fight against it. Unfortunately, that immune system gets dysregulated due to different reasons, and the normal harmless agents like food and other material which are around in our environment, our dysregulated immune system is unable to recognize them as harmless and thinks that this is something which is harmful to our body, and we developed an immune-mediated reaction which we call allergy. So this is the most simplest way of explaining it. There are different types of allergies, the most common being food allergies, which are very common in pediatric population. And most of the children who have pediatric allergies, they do grow out of them. There are certain allergies, which I'll come back to, which will persist in adult life, unfortunately. Apart from food allergies, we have atopic dermatitis, which is eczema, which we call dry skin. This is again a type of allergy which is most prevalent along with the food allergy, and is the most common encounter for the parents with the GPs and other specialties. Then we have allergic rhinitis and asthma, which go in hand. Allergic and rhinitis we understand as hay fever. It's seasonal, and different people develop different type of symptoms. And then if the allergic rhinitis is not treated and diagnosed promptly, it can develop into long-term asthma, which is another airway problem, which impacts on a person's life a lot. And studies have shown that patients who suffer from allergy and asthma, their quality of life is worse than a patient who has got diabetes, which is very interesting, and I'll come back to it to explain the reasons why. And then we have got, there are other diagnoses which come under the umbrella of allergy, but they are non-immune mediated, and they present as if it's an allergy. But if we do the normal allergy testing, most of the tests will come back negative. And they are normally discussed in allergy field, but they are actually non-immune. And it's eosinophilic esophagitis and FPIES. These are very uncommon conditions, but probably when you ask the allergy specialist, they probably see it more often than the general population. So these are the most commonest allergy conditions which we as specialists come across. The most important question and the most common question which most of my colleagues and relatives ask me, why we are seeing such a big rise in allergy. There has been millions of studies done so far. This allergy field has been expanding every day, and people have spent a lot of money trying to figure out the reasons why we are seeing such a huge increase in allergy, all sorts of allergy. When I use the term allergy, I will just put everything under the umbrella of allergy. If we discuss the specific topics, then we can explain a little bit more detail, asthma, eczema, and food allergies separately. But for time being, for the sake of this discussion, I'll just put allergy in under one umbrella. So the studies which have been done so far, the most commonest and the most well-known and validated pathogenesis, which has been agreed by most of the researchers, is we call hygiene hypothesis, which probably we all have observed that the reason why we don't see a lot of allergies still in Africa and Southeast Asia or other third world country is simply because children in the young life have been exposed to a lot of germs early on in their life, which actually regulates their immune system, which means that every time you have an encounter with an infection or a virus, your immune system is getting a constant feedback from the environment. In the Western countries, over the years, the use of antibiotic, the more hygiene conditions, people are getting less infections. The rise of infections going down has been parallel to the allergies going up. And this has generated the hygiene hypothesis that people who are much more in a cleaner environment, their immune system goes dormant, which means that your immune system is not exposed to the organism which would have been 50, 60 years ago. And over the years, the more westernized lifestyle, the more less infections, the more use of antibiotics, and then the more rise of allergies. So essentially, if I summarize it, the more cleaner environment you are, the more likelihood is that you're going to get allergies. It's a very interesting phenomena. And I think it took me a while to get my head around it, that how come you're clean and you're having less infection, but at the same time you're having more allergies. But that is the bottom line of all the allergy studies or research we have done so far. And now we're getting more new information about the allergic mechanisms. And I think over my career in the last 10 years, I have seen a lot of new guidelines coming into place where people were told, especially women when they were pregnant, not to eat peanuts during pregnancy. I remember it. I was told not to have a peanut during when I was pregnant. And now those guidelines have been taken back because we have seen such a huge rise in peanut allergy. And there have been big studies going on which have actually seen that the more we are excluding these foods from our life, the more we are dysregulating our immune system, which means that every time we take a food away, we see a big rise in the allergy purely because our immune system, which should be exposed to these allergens, is not being exposed. So there have been a lot of contradictory information from allergists, I'm afraid. There was time when we were saying that we should exclude all the food from children and introduce them when they're 6 months old or 1 year old. But now the consensus is that even if you have a child who's got allergy, the siblings should be exposed to a balanced diet as early as possible. So I think it opened up a whole Pandora box of a discussion among the allergists, and people were having discussion whether we're giving a lot of contradictory information, are we going to put people more on risk of anaphylaxis? But I think overall everybody has agreed that even if your older sibling or older child is allergic, the chances of having a subsequent child with allergy is high, but we should not recommend that everyone should exclude all the food from the child and just introduce. It's a good idea to introduce one food at a time, but I think my limited knowledge still says, but I think it's a good idea that unless and until you have allergic reaction which is proved by the skin prick testing and other testing, I think we should expose our children to all sorts of food sensibly, but make sure that they are not excluded from their diet. So that's one practical thing which I have learned during my allergy MSc. The other is there are a lot of other factors which have been picked up during different research studies. Children who are born on the farm are less allergic because they're exposed to the more friendly bacteria during their early life. Children who are breastfed are less likely to have allergies. Children who have got more vitamin D in their body are less likely to have allergy. So there's a whole, it's a jigsaw puzzle, I would say, that asking someone why somebody develops allergy is not one reason. The hereditary is the biggest reason. If you have a family history of allergy, you are more likely, you are more predisposed to have allergies in future. But if you have a predisposition and you are in an environment which is going to make you more allergic, you are definitely going to develop allergy. So having said that, that there are predispositions, you still can do things which hopefully will prevent the uprise of such a massive epidemic of allergy. Skin allergy being the most commonest, eczema, it starts with the dryness of skin, and if it's not treated, it gets worse and worse. And actually, the new theory says that it's not the food allergy which causes eczema, it's the other way around. If you have a child who's got dry skin and he's got eczema, because of his break in the skin, he becomes more sensitized to the food he's not even been exposed to. So I'll give you an example. If you have a child who's born who's got severe eczema, and if that severe eczema is not treated, he will develop food allergies purely because the break in the skin, he's got food in his environment all the time. So if you have a child who's got severe skin allergy and eczema, before he gets introduced to the food through his mouth, his body will be or his immune system will be exposed to the food allergens through his skin, and he will get eventually sensitized and develop food allergies. So I think practically, I would definitely ask the mums to please pay a lot of attention to skin. If you have a child with eczema, forget about the food allergies. I think the most important thing is that you need to make sure that you put lots of moisturizer, keep their skin under control, and don't be scared of using steroids. There are a lot of parents who have got a lot of anxiety about using steroids. Steroids are good medications, and the side effect develops if you use it for over years and use it against the medical advice, which means that the way doctors and pharmacists advise you how much quantity are you going to use, how do you thinly spread it on the skin, and how many times you can use, they are quite safe, and they can prevent your child from having sleepless nights, which will impact on their long-term behavior, which will impact on their educations, on their concentration. So all those sorts of things. If you have a child with eczema, please do make sure that you follow the instruction exactly the same way. If you have to put the moisturizer 3 or 4 times a day, please make an effort. The more the skin is under control, the more you're going to prevent yourself from having more problems in the future, which means not only the food allergies, but they will get sensitized to house dust mites through carpets, they will develop allergic rhinitis, and they will eventually, this is a whole allergic march we call. So allergic march starts with having a dry skin, and if it doesn't get treated on time and properly, you can have a child which will have a proper allergic march. And in my career, I have seen children simply having eczema, developing the proper food allergies, having allergic rhinitis, and then going on to have long-term inhalers for the rest of their life for asthma. So I have been always very passionate, and whenever I see a child with eczema, I think the first advice I give to the parents is please make sure that you pay a lot of attention to their skin and do exactly what the GPs and your specialists are telling you, making sure you exclude all the perfumed products for wash out of their system. Simple water is fine. Putting a lot of moisturizer as a soap doesn't make any sense because we're used to having a shower with the soap and shampoo. But I think these children, the skin of these children is so delicate that you have to keep it under control. So lots of moisturizers. For flares, you need to give them steroids, tapering dose. Don't introduce steroids suddenly and take them away suddenly, because you're literally giving the skin, you're not even giving the skin time to heal. 5 days of steroids and then completely taking them away and thinking the skin will magically improve. It will not. It takes weeks and weeks to get on top of eczema. And it's just not childhood. If it's not treated, it can continue to have impact as an adult. And it's quite a severe condition. It's just not simple skin. Food allergies, practically, I think the most important thing is getting them diagnosed on time and getting them diagnosed correctly. Most of the people who have children with food allergies will know that whenever you go to a GP or a specialist, you're sent to do some skin prick testing. And the thing which most of the time I see parents struggle to understand is that the skin prick test has come back positive to 3 millimeter to egg. The child has never been exposed to egg, and people just get worried, oh my God, his skin reaction is 3 millimeter, he's severely allergic to egg. If your specialist is saying that his skin is sensitized, but he does not have an allergy, please trust them. Having a sensitization on a skin prick test is very different to having an allergy. Skin prick test only gives you an idea of whether your immune system is responding to an allergen or not. It doesn't give you any more information. So you have to interpret a test in the context of history. If you have a test and your son had an egg and he did respond in an allergic way, then yes, it is a confirmed allergy. But if he's not been exposed to egg or he's been having egg regularly, please do not exclude it. This is skin prick testing and allergy as a phenomena are two different things. Skin prick testing only gives you an immune reaction to the allergen. It does not necessarily mean that your son has an allergy. So this is something which I have seen in clinics and over the years when mothers are so scared that they actually completely exclude those food. So this I would recommend that definitely having a discussion, making sure that you understand the rationale of the test and how to interpret it. Just having a skin reaction does not mean that your son has or your child has an allergy. The most other common scenario which I come across is that the older son, a child has a food allergy and the little one is born. Nobody has introduced any food, and the mums want to get skin prick test. We do not recommend skin prick testing on a child who's not even been exposed to any food. Even if your older child has multiple food allergies, the chances of your second child having food allergies are still 50%. So looking at the glass full or half, you can say that maybe there's a 50% chance my second child will have an allergy, but equally there's a 50% chance he will not. So in that case, we do not recommend any skin prick testing. We just recommend being sensible, introducing one food at a time, but giving them every opportunity to enjoy every food. So if your older child has food allergy to milk, wheat, egg, or soy, or sesame, or nuts, when you start weaning them at the age of 4 or 6, it's another discussion. You introduce one non-allergic food at a time. So most of the fruits are non-allergic, and the incidence of still food allergies with the fruits is quite low. So you can introduce one food at a time, which means you can introduce, rather than giving wheat, milk, and banana at the same time, the recommendation is give them one food at a time and see how they react. If they are having no reaction, then the food is quite safe. If they do have a reaction, then you have to stop the food, you have to consult your GP and ask their advice and get the skin prick testing. And then if the skin prick tests come back negative and the child is still having the allergic reaction, then you definitely need to see an allergist to go through the whole profile of exactly what's going on. Anaphylaxis is a life-threatening condition. It's a severe allergic reaction. It's just not a skin reaction. So if you have a severe, if you had an allergic food and you have a severe rash with some cardiorespiratory compromise, that is anaphylaxis. So just having a bit of tingling or just having a bit of rash is not anaphylaxis. The treatment is antihistamines and EpiPen. So if somebody has a severe allergic reaction and they collapse or they have a respiratory compromise, which means that they get swelling of their lips or mouth, or they're finding difficult to breathe, then you need to give them EpiPen. It's quite safe. It saves life. So some people have a lot of anxiety about using EpiPen. It's a life-saving medication, and you have to use it according to your GP and specialist advice. If by mistake, if you're not sure and your child is having a reaction which doesn't turn out to be an anaphylaxis, and you have given EpiPen, it's still safe. So please, it's a life-saving treatment, and if somebody is having a severe allergic reaction and you're not sure, it's best to give them EpiPen rather than not giving them EpiPen. Having a full plan of your child's allergy is always recommended. Having the written information is the gold standard. So if you're traveling or you're going to a country where English is not spoken, make sure you've got cards which are translated into the language where you're going. If you're going to Germany, make an effort, make sure that all the allergic advice, you have your own medical card in English, should be translated, or you can translate it and just keep a photocopy. So if your child is a teenager, is going out and you're not around with him, and if he does have an allergic reaction, that at least there is some information as to exactly what people need to do. Teenagers, difficult age to manage allergies. They're becoming much more independent. They are not adult, they're not children. A lot of hormonal changes. And I think as an allergist, we struggle to get on top of their allergies purely because they have a risk-taking behavior and they feel that they don't need the EpiPens, which mom used to send them everywhere. It's just the education and just going through things with them slowly and making them aware that risk-taking behavior will put them on a lot of risk, more risk. The highest incidence of anaphylaxis is unfortunately still in teenagers. They go out with their friends and try foods they haven't tried for years, and they say, well, you haven't tried, let's see what happens. And they end up having severe anaphylaxis reaction. And we have seen, all of you must have read in the news, teenagers dying because of the peanut allergy. So I think going through things with them, making them aware of their condition, making sure that they understand why they need to use the EpiPen, even if they're not used EpiPen for their life, they still need to carry it around in case if something happens. The other most important topic is allergic rhinitis and asthma. If you have a child who is developing symptoms of hay fever, which means sneezing, itchy nose, runny, watering of the eyes, or blocked nose, mostly in the mornings during different seasons, this is again is the allergic reaction to your upper respiratory system. And if you don't use the allergic rhinitis, the research have shown that the changes not only stay to the upper respiratory, they go down and involve your lower respiratory system, and people develop asthma. So if you have a child who's just got hay fever, take it seriously. Make sure they get their medications. If they're on antihistamines for runny nose, they need to take it regularly, regardless if the hay season is there or not. If they're on fluticasone, a nasal spray, which is a steroid nasal spray, they need to take it regularly, regardless the season is there or not. Some people find it difficult to use their inhalers just because they think that they're useless and they don't really improve anything. I think there are two types of inhalers. One is the salbutamol, which is your reliever, and there's one which will prevent you from having asthma. So you need to take both of them. The reliever is when you need it, you can take it, but the other one, you definitely need to take it regularly, whether your asthma is controlled or not, because that is the medication which is keeping it under control. There are other allergic reactions which are non-immune mediated, and people develop something called urticaria, which is not an allergy, which is just an idiopathic reaction, which is non-immune mediated, and you get exactly the same symptoms of rash and itching. And when the doctors do the skin prick testing, the allergy tests are negative. So those are different from allergies. So those are simple urticaria, which means that you are just intolerant to a food, like lactose intolerant or wheat intolerance. So intolerance is different from allergy. So I hope I've given you some practical knowledge about allergy. It took me 5 years, so it was difficult to summarize all my 5-year knowledge into 20 minutes, but I hope I've able to discuss most of the things which are relevant and which are practical, and I'm more than happy to take any questions if you have. Thank you.